Hi, everybody. Thank you for joining me. My name is Ben Chateau. I am a physical therapist by training, and I am now the administrator here at Signature in Payette and our Nampa offices. It's great to meet you. I am so sorry I don't get to see you in person yet. It's definitely my intention to get out there in the community and meet everyone face to face. I am from Idaho, born and raised here, have family that live in Payette, also New Plymouth and Emmett, and throughout the state, actually. So it's just exciting to be back here in these communities and trying to do what we can do to make our communities better. Today, we're going to talk about wound care and Signature's wound care program. I think we can offer a very unique service to our community that nobody else has, and I'm really excited to present on this today. First of all, our service is provider-led. We are very lucky and grateful to have Christina Serway, nurse practitioner, joining our team. She's been with us since the start of the year, and she is not only fantastic at primary care, she is also a wound care specialist. She has been doing wound care management for over 6 years with St. Luke's Wound Center, and now is helping us improve our expertise and our program, and is leading the way within Signature. It's really interesting how we've been able to develop this program, and we just have a lot of options and ways that we can help manage your client and really come alongside and partner with you to make sure everyone's getting the best quality of care, particularly when it comes to wound care management. First of all, you can utilize her service as a standalone, right? It can be just primary care only. She can come in, consult, or even ongoing care with the client depending on the need. It can be traditional home health care only, right? We have a fantastic home health care team that's used to managing wounds. They have had additional training with Christina to really improve the skill sets that they already had on how to best manage the wounds in and within our particular patient population. We also have the option of having Christina come alongside our team so she can lead our home health care team and do dual visits. She can come alongside and as a consult and really help us provide the best possible care. We can also utilize her expertise and her relationships over at St. Luke's and St. Luke's Wound Care to work more closely with their team. We've been able to develop a very close working relationship with them where she has pretty direct access to their providers. We can utilize telemedicine to get consultations done in a very timely way. And it's just been a fantastic experience for us and for them, being St. Luke's, and then also the clients that we've been able to service. In addition, our team can utilize telemedicine, whether they're contacting her via phone or using FaceTime or Zoom or anything like that to do an immediate consultation with one of your clients that we're already seeing, right? So Christina can give her, best observations via telemedicine before we can get her out there for a full and complete examination hands-on. So it's just a lot of ways that we can utilize our services, and we're really excited to have those options. In addition, we have a very large service area, right? So we cover, as you can see on the map here, a very large geographical area, both in Idaho and in Oregon. You can see some of the towns here in Idaho that we go to, as well as many of the towns in Oregon as well. So a very large service area that we're able to go and bring our team to that rural community and really help patients and clients with wound care management and primary care management or home health or whatever, hospice, whatever they need. We're really a one-stop shop and have a complete continuum of care for the clients. And our goal is to really come alongside and partner with you to bring that continuum of care. Again, some benefit of working with us and our team, and particularly when it comes to wound care management, is back to Christina, right? She's got 6 years of experience over at St. Luke's. It's the largest wound care center in the state, state of the art. They're always keeping up with the newest and best changes in wound care management. And in that regard, they have a pretty large formulary. And oftentimes when people are leaving the wound care center's service, they are requesting certain dressing changes and certain bandage types, and a lot of the agencies just won't cover some of that formulary. And what we've been able to do with Christina and the St. Luke's Wound Care Center is really align our formularies, which means for us, we have a larger capacity of dressings and dressing options available for wound care management. And I think that is a real value add, because we can, again, if we're working with the wound care center, we can align what we're doing with them. And if we're not, that's okay too, because Christina can help guide us, and she has a wide array of options for different products and bandage types and dressing types to help manage that wound. In that vein, we are also, as far as I know, the only company in our area that can apply Snapback Systems at the bedside or at the patient's home. Typically, this has to be done at the wound center, either St. Al's or St. Luke's or West Valley, because it's not really a billable service under home health care, where it is billable under primary care. The snapbacks are a fantastic option for those that can utilize it. It's a small, a little bit bigger than a deck of cards, self-contained vac unit, not like the large ones, but they're a little finicky to apply. So if you apply them wrong, they're easy to break. So they're expensive, over $200 per unit. So you don't want to break them. They're not something that you're going to get reimbursed for appropriately during home health. So home health agencies do not want to carry them. We carry them so Christina can appropriately apply them. And it's something that has to be changed 2 or 3 times a week. And she comes in and does those changes for the client on an as-needed basis, or as long as it seems appropriate for the client in managing that particular wound. She's also very available to do minor debridements, callus management, and other, minor at bedside procedures, just because of her skill set. That is not always an option for other companies or other providers to do that. Something else that's really benefited our team is to use her expertise to train our staff further, right? So we have been taking our staff's already interest in wound care management and bolstering that education via online trainings, via in-person training, group trainings, and a lot of one-on-one visits with our providers. So everyone is really on the same page on how to best manage the wound and really how to best help the client. Like I mentioned, we also work with telemedicine options. We have been able to set up with St. Luke's and their wound care team and their providers to utilize MyChart and their particular app that they prefer to do those telemedicine visits. So if the client needs, to talk to Dr. Good or one of the other wound care management teams from St. Luke's, we can facilitate that right there at bedside with our staff, take the orders, and just proceed with the care. So it's really a seamless process. In addition, we are one of 2 preferred partners in our area with Suika, Surgical Wound Care Associates. Again, it just broadens our array of options that we can provide as part of our wound care team. Suika is a fantastic organization. You can think of them as a mobile wound care specialty unit. They really specialize in those chronic wound types, and when the product is applied appropriately, can really see these complex chronic wounds heal in a rapid manner. Of course, there's some screening that needs to occur to make sure it's the right wound and the right wound type, but what it is, it's a stem cell product that gets put in the wound bed, and it works fantastic. And then oftentimes it might be combined with some interventional cardiology to maybe place a stent or something in the lower extremity to ensure adequate blood flow. They've got relationships here in the Valley to get those things and those procedures accomplished. And our team can facilitate with Suika to really manage your client. It's usually paired with a home health care episode because there needs to be some specific skilled nursing intervention that goes along with it. Our team has been trained by the Suika team on what they want to do and how they want to manage those wounds. I've also just learned when talking with Dr. Lillenquist, who's head of this team, that they're now offering stem cell and amniotic fluid injections for pain management in the joint. And again, it's something new. It's just now getting covered with insurances, and it's a fantastic option for those clients that might not be appropriate for cortisone injections or other pain management options. Now we can offer this, or through Suika, we can offer this as an option for your clients. This is pretty readily available on the Idaho side right now. Oregon is still a case-by-case basis because of Suika and some of their limitations, but we can usually facilitate with some assistance, some transportation to make sure the client can be seen appropriately if we really feel like this is the best course of action. Just contact me and we can work through those details to see if it's something that would be best for your client, or our nursing team can also answer your questions. So how do you refer to us? Easy. If you want to talk to our primary care providers, just call our primary care line at 208-461-7664. Diana is here. She's the coordinator in the MA for Christina and Lisa and our primary care team. And if you have questions, just wanted to consult, just want to maybe see if it's appropriate for them to come out, she's the person you'll want to talk to. You can fax us directly. The fax number here is listed as well. You can send in your requests, your orders, whatever you need. We can be flexible, and that's why our goal is to kind of partner with you and to be as flexible as possible, because we realize logistically sometimes it's just difficult to get some of these things done, particularly the more rural we get. It's just it's harder sometimes to access services, and we want to eliminate that barrier to care. We are really excited to be able to work with you. And again, we really look at ourselves as an extension of what you're already offering the client. We want to partner with you and develop that nice continuum of care, whether it be our primary care, our home health, hospice, whatever it is, and use our wound care services to help clients. We realize wound care management is so important. It's a painful thing for clients. It's dangerous for clients. There's infection concerns. And it's also a compliance issue, right? If you're in a facility, we know that wound care management is a big deal on the compliance side as well. So our goal is really to partner with you, to be flexible, help eliminate that barrier to care that sometimes exists when we're trying to manage clients the best that we can do, right? And then with Christina leading our team, we know that we can offer services that other companies cannot. With our partnership with Suika, her expertise, her leadership, and then our fantastic home health and nursing team, we know that we can offer products and services that just aren't found anywhere else. And we're just excited to share that within our local community. If you want to get a hold of me directly, just call me on my cell number, 208-870-3350. I promise you, if I don't answer, I will call you back. If you have questions, just not sure about the program, anything, I would love to speak with you. I really would just love to meet you in person as soon as possible. Also, feel free to call our office. And then I've listed our fax number again here too for your review. So questions, anything I can do, just reach out, please. I'm happy to help in any way possible. I really want to meet you. We'll try to get those in-person visits as soon as possible. But in the meantime, be well, take care. I hope everyone has a fantastic rest of their day, and I just appreciate your time. Thank you very much.